which of the following structures is most commonly involved in the pathogenesis of the neurological symptoms associated with a Pancoast tumor? Gonna say off the bat, I don't even know what a Pancoast tumor is. 60-year-old woman with a history of smoking presents with right shoulder pain, arm weakness, and drooping right upper eyelid. Chest X-ray reveals apical mass in the right lung, and a subsequent biopsy confirms diagnosis of a Pancoast tumor. Which of the following structures commonly involved pathogenesis? All right. Okay. I don't know what a Pancoast tumor is, but it's dealing with a smoker. Again, 60-year-old woman, older, right shoulder pain, arm weakness, and drooping eyelids. So it's going to be a lung mass here, and then she's having pain that like will radiate to her shoulder, and so and drooping right eyelid, and that has to affect facial nerve too. Apical mass, you can brachial plexus, no, cervical nerve root, phrenic nerve, spinal accessory nerve. Okay, so just looking at the answers, again, I don't know. So brachial plexus doesn't make sense because it doesn't have anything to do with the eyelid there. Gotta knock that one out. Cervical nerve roots, I don't think it also, again, doesn't go up to the eye. Won't have to do with that one there. Phrenic nerve does radiate to the shoulder, but that's more of whenever you have I guess the phrenic nerve does go to the shoulder, but it doesn't explain the drooping eyelid. So I kind of want to knock that one out. Spinal accessory nerve. That's for which muscle is that? I don't remember. It's a back muscle. So I think Vegas one is the only one that really makes sense in my head. So I want to go Vegas.
Okay, final answer.
Yeah.
Okay, let's talk about this. So what does she have? Kind of a Pancoast tumor. Okay, a Pancoast tumor is just a fancy tumor that is the top of the lung. Okay, so usually it's either a squamous cell carcinoma or small cell carcinoma at the top apical portion of the lung. So when you have a tumor there, you have to think in your mind it can compress anatomically to local areas. In particular here, right, the patient has kind of right shoulder pain, right arm weakness, because you remember if kind of, where the top or the apical part of the lung is very close to the bottom of your neck or the floor of the neck, which is very close to your brachial plexus, which is why they have kind of that shoulder pain, organ weakness. So talk about the drooping right eyelid. What do you think causes that?
From the brachial plexus.
Yeah, I mean, it's mainly because you get Horner syndrome, right? And remember, some of the brachial plexus will have some sympathetic nerve fibers. So your Horner syndrome, right, is you have ptosis, meiosis, and anhidrosis. So you don't really sweat, right? Your pupils are asymmetric. One side is more, dilated compared to the other, right? And then you have ptosis, meaning that you have an eyelid drooping. It's because your sympathetics are the ones that control those areas. And so definitely for sure, remember that, some of the brachial plexus will hold some of those sympathetics. Okay. And so that's really kind of why you have the eyelid drooping. So it's all in the anatomy near kind of the top portion of the lung there. That's why.
Okay.
Okay, so they will ask about Pancoast tumor. So make sure you kind of understand Pancoast tumor. It just means that a tumor, right, is at the apical portion of the lung, which is top portion of the lung, which is near the neck. And so when the tumor gets so big, you start compressing nerves around there, mainly your brachial plexus, your sympathetic nerve trunks, and things like that.
Got it. Okay.
Okay. And of course, in theory, it can cause, spinal accessory, phrenic, etc. if it gets really, really big. But of course, the patient will complain of things like can't move her shoulder up and down. That's more for spinal accessory. Phrenic is, C3, C4, C5, right? Keep the diaphragm live so she won't be able to breathe as well, right? Her diaphragm's not moving as well. Vagus nerve is really not sympathetics. Those are parasympathetics, right? Which deals with the rest and digest system, right? So that's going to be the opposite here. And then cervical nerve rootlets, not going to really give you kind of that Horner syndrome kind of ordeal. Okay.
Got it.